Welcome to San Diego Made, San Diego Proud. I'm Allie Wagner. We are celebrating business members who have helped define San Diego as America's finest city. And with me this morning is James Helgager. James Helgager, right?
That's
from
correct.
Tri-City Medical. Thank you so much for joining us today.
Thank you for having me, Allie.
Now, Tri-City Medical has done some new things. I mean, they've brought in some specialists. Tell me about that.
Well, at Tri-City Medical Center about 2 years ago, we started the Orthopaedic and Spine Institute, which is a collaboration of the physicians at Tri-City Medical Center, as well as the nursing services, rehab services, and the hospital administration to bring state-of-the-art orthopedic care to our patients. We've introduced lots of new technologies. We've introduced a nurse coordinator onto our orthopedic floor who acts as to provide personalized care for these patients during their hospital stay, and she actually acts to provide kind of like a concierge service.
Nice.
We've also added a research division to the orthopedic services. So we've done a lot of new things.
Now, as an orthopedic surgeon, I mean, we're going to talk a little bit about knees today. A lot of people have issues with their knees. Now, what is the difference between a total knee replacement or a uni knee?
Well, let me just start out by describing a little bit of the basic anatomy of the knee joint. The knee joint is formed by the end of the thigh bone or femur, the upper portion of the shin bone or tibia, and then the third bone, which helps form the knee joint, is the kneecap or patella. And the surfaces of these bones are covered by cartilage, which acts as a cushion for the joint and provides for smooth, painless range of motion. Now, what can occur over time is that this cartilage can become worn, and this can occur as a result of injury, aging, arthritis, and if that happens and becomes severe enough, the cartilage can be worn away, and the patient will then be walking bone on bone, which is a very painful situation. Right. Now, there are just basically some other structures here in the knee. There are ligaments which provide stability, and there's these horseshoe-shaped structures, the menisci, which also provide some cushioning, and the menisci also can become worn with time and aging and so on. And certainly, if you have injuries to these structures, we can help you with that too at Tri-City Medical Center. But anyway, what a knee replacement involves is removing the damaged or injured surfaces of the joint and then replacing them with prostheses. So you remove just really a small amount of bone and cartilage, and you put a metal prosthesis over the end of the femur and on the upper part of the tibia, and then into that a plastic insert which really acts as the cushion that's been removed from the knee joint.
And really quick, tell me, I mean, these have gotten a lot easier, right?
These have gotten a lot easier. Patients generally now are in the hospital only about 2 to 3 days. We try to get our patients out of bed the same day of surgery. Many patients will use crutches or a walker for 1 to 4 weeks. The time that they'll do that is kind of dependent on their age, their general health, and so on. Now,
where can people get more information from Tri-City Medical?
Well, they can get more information by going to our website, which is www.tricitymed.org, or they can phone 760-940-3000.
Awesome. Well, that's a lot of information. I know a lot of people have some issues, so they should call. All right. Thank you so much for joining me. That's going to do it for San Diego Made, San Diego Proud for today. We'll see you guys next time.